Hi everyone, my name is Maggie Freese. I'm a genetic counselor and I work at the University of Iowa Hospital and Clinic specializing in cardiology. I'm currently working from home due to the coronavirus pandemic, but typically I work in a hospital and see patients within the Heart and Vascular Center. Now, as I mentioned, I'm a genetic counselor and many people don't know what exactly that is. So a genetic counselor is a specialized healthcare provider who helps patients and their families understand genetics and what it means for themselves and their family members. So I work a lot with ordering genetic testing for patients and then helping them understand what their results mean to them. And sometimes genetic testing results can then help doctors to decide what medications or therapies to use for patients. So it can make a big difference in a patient's care. Now, the field of genetics has been growing and growing over the years, and we still don't know everything about our genetics. So as the field continues to grow, we'll learn more about the causes of disease, including heart disease. As I mentioned before, I specialize in cardiology, so I work with patients with heart disease. And genetic testing can help to identify a cause for their disease. In many cases, we're also able to then identify their family members who are at risk. And that's significant because individuals with heart disease can be at risk for sudden cardiac arrest. And if they're being followed and managed appropriately by a cardiologist, that risk can be greatly reduced. I first knew that I wanted a career in STEM when I learned about genetics from my high school biology teacher, Mrs. Lumberg. We were learning about Punnett squares and inheritance, and I just found all the information so interesting. And my teacher was very, very passionate about science, which made me want to learn more about it. And she was actually one of the first people who pushed me to pursue a college degree in biology. So I went to Drake University in Des Moines, Iowa, and I received a bachelor's degree in biology. While I was in college, I worked in a lab doing research. I enjoyed the science aspect of it, but it was missing working with people. So I researched different careers online, did some job shadowing, and realized that I wanted to be a genetic counselor. In order to be a genetic counselor, you have to complete a 2-year training program that specializes in genetic counseling. There aren't a lot of schools that offer this training program, and the class sizes are usually only about 8 students. So it can be really, really difficult to get into a program, especially on your first time applying. And I definitely got discouraged because of that. But I didn't want to give up on myself, and I knew that if I worked hard, I could get into a program. So I studied, and I tried to keep my grades up. I practiced interviewing with my friends, and I ended up getting into a program at Indiana University School of Medicine. And I spent 2 years living in Indianapolis, Indiana, and loved it. I'm originally from Iowa, so after that program ended, I decided to apply for a job at the University of Iowa Hospital and have been there ever since. I've thoroughly enjoyed working in STEM, and I encourage all of you girls to continue learning more about all the various career opportunities available in the STEM workforce. Thanks so much for your time, and if you have questions about my role, about my career, profession, my story, essentially, please feel free to reach out to me. Thanks again.